Good afternoon. I'm George Latimer, Westchester County Executive. It is Monday, September 14th, and I'm here for our weekly Westchester Coronavirus Update report. And of course, as we have been wont to do, we're going to add some other issues that are timely at the same time. Our numbers for today have been announced on the New York State Tracker, which anyone can take a look at. You'll see statewide information broken down by county and in a host of different ways. You can find that on the New York State Department of Health website. Just enter New York State Department of Health COVID-19 Tracker. The chart will come up. You'll see a map and you'll see some other numbers. Our numbers for today show that over the last day we had 40 additional individuals test positive for a total year-to-date of 37,571 individuals in Westchester County that have tested positive for COVID. 2 weeks ago today, we had an aggregate total of 36,984 individuals. So the net difference between that is the number of active cases, which is 587 active cases. Now, that number is the same as it was yesterday, and slightly below the peak of a couple of days ago, but it is a significantly higher number than we experienced over the last few months or so. At one point, we had the number of active cases down as low as in the 420 mark, and so to be as many as 587 is an important statistic. I'm going to try to put those numbers into perspective after I give you the basic update today. But again, 40 individuals tested positive yesterday. 37,571 is the total year-to-date for number of people positives, and the number of active cases thereby is 587 active cases. We have tested 591,914 individuals. There's a certain duplication factor, triplication factor in some cases. There was 3,300 tests yesterday. That's slightly below the normal number. As you might expect, however, on a Sunday, we have routinely been in the 4,000 to 5,000 range in people tested. But we are now approaching the 600,000 test mark, which in rounded numbers means 60% of Westchester's population has been tested for COVID, and we're approaching the point, if we continue on this path, where we will reach almost 100% testing in the foreseeable future. Now, people get tested for many different reasons. Potential exposure to the disease is usually the single most important reason, showing certain types of symptoms that makes an individual believe that they have that. So it is not a systematic testing of the population as a whole. And there are, as I said, duplicates and triplicates within that number. But that is a significant percentage of people who have been tested. As I've said since the beginning of this pandemic, we've been doing these updates now for over 6 months, that this represents a significant number of people tested, and that does give us some information. We had one death overnight to reach a total of 1,453. That is our first death in the last 2 weeks, and we have not gone 2 weeks previously since the beginning of this infection with only one fatality. So we mourn the individual that did pass away. We hope that we'll continue to have 0 deaths night after night, and of course fatalities are an important factor to judge how we're doing. The last information we have on hospitalization, there is usually a multiple-day lag time. And the last hospitalization number we have dates back to Saturday, the 12th, in which we had 38 individuals that were hospitalized. That number is a little higher than the lowest amount which we had within the 2-week period, in which we got down to as low as 21 people hospitalized. That number of 38, though, was still a relatively low number. We're talking about hospitalization rates under 5% of all the people that are infected, so that is a good sign. And the 1,453 fatalities when compared against all the people that have tested positive is slightly under 3.9%. So that is the fatality rate of all those who have been infected, under 4%, under 3.9%. That number has been pretty static and dropping slightly. The more people that are tested and the fewer that pass away, the more that fatality number drops as a percentage of the total number of people. So those are the numbers that we have specifically as of today. As I said, I'm going to come back in a few minutes and try to give you some context by which you can judge those numbers. As reported this weekend, there was a positive case of COVID-19 in the Tuckahoe School District. We've spoken to Superintendent Dr. Amy Goodman. She communicated to the parents in the district at the William Cottle Elementary School that one individual tested positive on Friday. That person is now isolating, and those students and staff members who have been exposed have also been contacted. The district responded very well in this matter, and I want to compliment them. Obviously, this is a test for schools being open. We will have positive cases that will arise, and how quickly we respond, how well we communicate, how quickly we test other individuals and isolate will all be the response that's necessary if we intend to try to continue a school year and get in as much education as we can. This individual showed symptoms on Friday. They were tested, and the positive result test came that same day. Now, normally testing does not get an immediate response, but we have accelerated the circumstances whenever we're in a school setting, because we are concerned that the spread could be profound in a school district with many other students and teachers and administrators, more so than just an individual by themselves. Students and staff were immediately notified, and the school district did a really exceptional job of keeping everybody small, together, and focused. There's a lot of confusion about the issues of isolating and quarantine. So the first thing is, people will, in conversation, sometimes on the internet, express an opinion or something they heard. They relay it as if it were a fact, and there can be some misinformation out there as people sort of portray what they think is true. But the Westchester County Health Department is following the New York State Department of Health guidelines, and that is a mandate that anyone who is tested COVID positive must isolate. That's isolation now. That's not optional. That's mandatory isolation if you have tested positive for COVID. And that is a 14-day period of time in order to make sure that if the virus does incubate and become full-blown in your system, that you are not conveying that to other people. You might test positive. You might not show any signs of infection, but you might be infectious to other people. That's the purpose of the isolation. If you're exposed to someone who is COVID positive, you must quarantine for 14 days. You may not have the disease, but you may have the disease. There's no way to know if you've conveyed it to other people. So by quarantining for 14 days, you reduce the number of people that you're exposed to. And this is regardless of whether you get a negative COVID test or not. I must say that you can do the math on your own, if we've tested 600,000 people, and we have 37,000 positive cases, the number of total positives is a very small number. That number is under 7% of all the people tested. However, a test is a snapshot of a picture at a certain point in time, and it is possible that a person who might have been exposed to COVID might be tested, be negative, and then a few days later wind up being positive and then thereby contagious of the disease. So, it's an abundance of caution, because we saw how fast this disease circulated in our county back in March, and it went like a lightning bolt through people, that individuals wound up becoming infected and carrying it to other people in instantaneous circumstances. We went from one case to 100 to 1,000 to 10,000 before we could even turn the corner. So we take these precautions of quarantining and isolation in order to stop the spread. Now, we've been fortunate as we've functioned ever since the peak, which came in late March and the first half of April, in that we've seen a diminution from the peak. We flattened the curve way back then, and then it's been dropping down. Lately, we've seen some increase in some of the indicators, which tells us that COVID is out there. The fact that we've started to open up a variety of things in the society. Back in June, we started opening up in phase 1, phase 2, phase 3. We opened up restaurants, first outdoor, then indoor. We've opened up retail establishments. People could go back to work at a reduced number. People could go to religious services at a reduced number. They could meet outdoors up to a certain number of people. But as we see what we think is the diminution of the infection in our backyard, at least in Westchester County, it's very easy to drop our guard, to become lax. Many people, most people here in this county, are practicing social distancing and wearing masks, but it's not universal, and it's certainly not universal in other parts of the state or other parts of the nation. So we have to make sure that we're protecting against this spread from coming as we watch these numbers and try to interpret what the numbers are telling us. There are a couple of things to mention that are not COVID-related. The U.S. Open, the men's golf U.S. Open, is being played at Wingfoot in Mamaroneck this week. It is the 120th U.S. Open. It's the 6th time that a major men's golf tournament has been held at Wingfoot here in Westchester County. We have a long, storied history with golf in this county. There are as many golf courses here as there are in any other location in the United States of America. We've had women's professional golf and men's professional golf tour stops as well as majors here in Westchester County. We had hoped that this U.S. Open was going to be played back in June, which is the traditional time for the golf opening, and it is a huge economic generator when it is held. In this case, we're now holding the golf tournament without benefit of spectators. It will be broadcast on television, which for the economics of the golf tournament is where more of the money is made, through the television audience and the advertising and so forth. But we lose the excitement of having people there, and we also lose the economic benefit of having people stay in and around our area, filling our hotels, dining out for restaurants, buying things in the various stores during the times they're not out on the golf course. So it has dampened the economic impact, but it hasn't eliminated it completely. And we're very happy that this event occurred because it almost didn't happen. There was a time at which the USGA, which puts this on, had considered moving the venue to a different location in the country. But of course, we were the first but not the worst of all of the impacted areas, and then alternate areas in the country, Pebble Beach and others, also saw infection in their areas. So the USGA decided to play it without spectators, and that's a significant number. The U.S. Open would normally get 40,000 visitors a day, and that's a major logistical issue. In other contexts, I'd be telling you about where the parking queues would be in different parts of the county, where to avoid being on the Hudson River Parkway. All of that would have happened were the tournament to have outside spectators. There is still approximately 2,000 essential personnel that are going to be on site in order to run the tournament and cover it through the press and so forth. We have allowed at Playland parking lot there to be testing for COVID purposes for the people that will be on site at Winged Foot, and as a small proportion of it as it is of the normal turnout, it's still a significant number of people. We want to make sure, once again, that the virus doesn't spread. It is important for us to host this tournament this year. There's a certain rotation between major golf courses that host the U.S. Open. Certain golf courses of a certain magnitude, Pebble Beach in California. If you know anything about golf, there's a number of other ones, Medina Golf Course, Marion in Pennsylvania, Oakmont, Baltusrol in New Jersey, Shinnecock, and Winged Foot has been part of that rotation. And to fall out of this year's tournament would have meant a long wait before it could come back to Winged Foot again, and the economic benefit that it has. So to show that Westchester is able to host the tournament is an accomplishment, and we thank all of those folks from the USGA who will be here. The top golfers in the world will be in our backyard. They'll be playing at this storied golf course, and we hope as best as we can in this age of COVID that we can have a successful tournament and host this as well. I also want to mention that this being Monday, September 14th, tomorrow, Tuesday, September 15th, is Village Election Day across New York State, but for our purposes in Westchester County. Now, the villages that exist around the county do not all have an election day tomorrow. Normally, there's March elections for villages. These elections were the ones that were scheduled for March and were postponed because of the COVID impact. Governor Cuomo canceled it at its time in March and rolled the date down until tomorrow, September 15th. There are 5 villages which will have village elections for which there are not contested races, where there is one major candidate running. That is in the village of Buchanan, the village of Larchmont, the village of Hastings-on-Hudson, the village of Briarcliff Manor, and the village of Pelham Manor. In each of those cases, polls will open. Now check through your local village clerk. Most polls open at 6 a.m., a couple open at 7 a.m. And in these cases where there are uncontested races, there will be a single voting site within the community for you to vote, and there will be a write-in capacity in those elections. But again, tomorrow, the uncontested races are in Buchanan, Larchmont, Hastings-on-Hudson, Pelham Manor, and Briarcliff Manor. Also in Pleasantville and Sleepy Hollow. I neglected to include those, so there's 7 altogether. Pleasantville, Sleepy Hollow, and the 5 that I mentioned. There are 3 that have competitive races for either judicial or village trustee or mayoral races, depending on which of these different villages we're talking about. So the 3 where voting will convey who will serve in office and which group of people will have the majority authority are the village of Tuckahoe, the village of Bronxville, and the village of Scarsdale. So if you're watching this and you live in Tuckahoe, Scarsdale, or Bronxville, you have the opportunity to vote tomorrow. Since I can't go through 10 different communities in each different voting location, call your village clerk. Do it now if you're watching this in real time before the day ends, and you'll find out all the details you need to vote if you aren't already aware of it. And this is a chance for you to have involvement in your local government. Towns and cities will not have voting this time of the year. There'll be some other elections, and of course we'll get to those as we get closer to November. But the village election day is important. What I wanted to highlight as I complete the report today is to help you understand some of these statistics and how to interpret them. I've touched on this a little bit in my prior presentations, but I think the phrase I've used is we don't track statistics because we're baseball fanatics or football fanatics and we want to check the ERA, the batting average of a player and compare them and see how it compares to past history, who's had the best season for RBIs and so forth. We track these numbers in order to tell us the scope of the virus. Since we don't have a vaccine and we don't have an antiviral treatment, we're not in a position to directly stop the virus with those tools. And those would be the essential tools that we have to have as a society. And as we all know, when medical science comes upon the proper vaccine, properly tested, we will all rejoice. We hope that comes tomorrow. We hope that comes the day after tomorrow. As soon as that can come responsibly, we embrace it. But until that happens, we have to take certain measures. And while we take those measures, the single most important strategy that we have is to reduce the spread. To understand whether we're spreading the virus or not is to look at a series of statistics and interpret things. And as happens in almost anything, you'll look at 5 or 6 or 7 different numerical indicators, and they don't all match. They don't all tell you the same thing. You have to be able to interpret it to some extent. What you do after that interpretation are the actions of government or in the private sector to help do these things. The governor certainly shut the economy down back in March by closing most everything. And then through the series of phases that I've alluded to that we've lived through, we opened up step by step. In the first phase, they opened up construction projects that were essential. In the second phase, they opened up retail of a certain type and outdoor dining. And then in the third phase, indoor dining. And then ultimately, as one-offs, the governor has opened up gyms and health clubs. At one point, a very happy day for me, we could go to the barbershop and get our hair cut. Women could go to the beauty salon, get their nails done. That was at different times. But each of those different entities had different realities of the way people interact. And, I can just imagine it for myself. If I walk into a restaurant, I'm interacting with the service personnel in one fashion. If I get my hair cut, I'm interacting with the barber in a completely different way and in a closer way. So each of those different entities had different rules and requirements for sanitization for those interactions. We in county government had to make decisions of how we opened up our operations and how we serve the public in different contexts. And of course, we talked quite a bit earlier this year about how we handled the various recreation facilities which were within our authority to open or close, and how we opened golf courses and Bicycle Sunday and then ultimately beaches and pools, but we did not open Playland Amusement Park. We did not have the festivals at the Kensico Dam nor the fireworks. Each of those things became decisions we made subjectively based on how hard would it be to implement protections from the spread of the virus. How often do we sanitize a surface? How do we enforce mask wearing? How do we enforce or make easy people hand washing or sanitizing their hands? All of those different things came into what we do when we get the numbers and we interpret the numbers. But let me talk about the numbers themselves so that when we see something that we then know what we do. And ultimately, if the numbers all start to indicate a rise in the spread, then the actions we take would be to shut down elements of the society that we've opened. And we don't want to do that. That is not a wish here. I long for the day when we don't have to wear masks and when you can greet somebody with a warm handshake or a pat on the back in the normal way that we as humans operate. But because the virus is very much with us, even with reduced numbers, we don't have that flexibility, and the ability to interact in some places have still not been open to us, such as movie theaters. Movie theaters have not been open to us. All summer long, we would have loved to have had a summer concert with a few hundred people, watching a performance, but that was all eliminated as part of this in order to reduce the spread. So what are some of the numbers we look at? First of all, when a person gets tested and tested positive, they cross over into a category that we have to look at more carefully. If you test and you test negative, the presumption is that you don't have the virus. Now, I just said a second ago that if you've been exposed to the virus, this is not just a test you're doing to check your general health. This is a test because you believe you may be exposed to the virus. You still have to work on the side of caution and isolate yourself so that the virus does not manifest itself a little later on, and then in that period of time where you tested negative, but then you started to show symptoms, that truthfully you wound up spreading the virus. But of all the people that get tested, we've just mentioned this a second ago, 93% of the tests now have come back negative. So even though we have 37,000 people that tested positive at some point in time, we've tested almost 600,000 people. So if you do the math, you'll see that the vast majority of people have tested negative, and that's a good sign. We look for the number of people that test positive every day, and we compare it against how many tests did we have overall. And the magic number we're looking for is the vicinity of 1%. If we have 4,000 people tested and 40 people come back positive, that's a 1% infection rate. And that rate will go up and down from day to day. As I look at certain numbers over the last week, on a given day, we had 3,600 people tested. We had 31 people positive. That's under 1%. The following day, we had a little over 3,000 people tested, and we had 32 people test positive. That's over 1%. But you're looking for major spikes. You're looking for that 1% number to jump up to 3%, and then maybe to inch up to 4%. And the larger you test, the larger the volume of positives is. That would tell you something about the spread of infection. So even if the absolute numbers of positives go up, if we have 50 more positive cases in a day, the question is, how many people did we test? If we tested 5,000 people, that's still a 1% ratio. And you've heard people say nationally, the more we test, the more positives we find. That's true. But the more you test, the more you find out the scope that the disease might be. And if the percentage of infection is at 1% or even higher than that, 2%, you're showing that the infection is not as widespread in the population. When that number reaches a higher number, then we have a problem. And we had points in time when we were testing, imaginarily 100 people, and 30 of them were coming back testing positive. That's a 30% infection rate, and that's when the virus spreads. So you look at the number of people tested, and you look at the percentage of infection as a very important indicator. The next thing you look at is how many active cases are there. And an active case we define to be the people that have been tested and over the last 2 weeks tested positive, and over the last 2 weeks have not yet cleared the 2-week incubation period. That number can grow depending on how many people test positive in a given day. And those numbers, as I've just indicated, have risen. And if those numbers rose along with the infection percentage, then we would have something to be concerned about. The infection rate has stayed low, even though the absolute number of cases rise up. So now we'll start to look at those cases in a second when I give you the next couple of indicators. We've got an indicator that says the infection rate isn't high, but the absolute number of infections have started to rise with the amount of testing. So how many active cases? Today, 587 active cases. That's more people to keep an eye on, active cases, than we had a couple of weeks ago when that number was in the 400 range. So that's a concern. Now, what do you look at from there? The next thing you look at is, of the active cases, how many people have gotten severely enough sick to warrant hospitalization? And you look at the hospitalization number. That number's jumped up a little bit from, at its lowest, about 22, 23 people, which was a continued diminution, has jumped up a little bit into the upper 30s. We've gone 2 or 3 months basically in the range of 30 or 35 people hospitalized. I've mentioned before, at our peak hospitalization, we had 1,200 people hospitalized. Now, the good news, if you go back to when this all began, and you saw what was happening in China and Italy, which were the first 2 countries that we saw examples of, the number of people that were sick enough to be hospitalized exceeded the capacity of the healthcare infrastructure to help them. And you saw, as I did, videos of people in hallways of hospitals that couldn't get a hospital bed, couldn't get an ICU unit attention, could not get a ventilator to breathe on. And many of those people died because the hospital infrastructure was overrun by the amount of infection. And that happened early on in a number of places. Westchester County has about 3,100 hospital beds, and in round numbers, roughly about 250 ICU beds. About 160 of those are operative, and we have about 100 in storage awaiting usage if necessary. Since our peak period was about 1,200. We never exceeded the amount that the infrastructure could provide, and that would be a bad sign, because if we exceeded the amount of the hospital beds that we had, the ventilators that we had, the ICU beds, then those people are going to suffer fatality, and the virus can spread much more aggressively in a situation like that. We never reached that point in Westchester. We're grateful that we flattened the curve. That's what happened. It got all the way up to 1,200 hospitalized, then it flattened out. And that was good news for us. Right now, we're talking about 30 or so people that have been hospitalized. The next indicator you look after that is, what is our fatality rate? Now, I mentioned that our fatality rate now is slightly under 3.9%. That means of everybody who's been infected, 37,000 people year to date that have been infected, we've lost 1,453 people. That's the number of fatalities. When you do the percentage of that, you'll see the percentage is slightly under 3.9%, under a 4% fatality rate. When people make comparisons to the flu and they say, well, this is just like a bad flu. No, we don't get a 4% fatality rate in the standard flu. Now, we have a vaccine for the flu. Most of us take it, and most of us don't get the flu, or if we get the flu, we don't get it in severe enough circumstances to suffer fatality. It depends on your health when you get the disease, both the flu and, for that matter, coronavirus. And what we've seen is the older you are, the comorbidity of having other things that are wrong with you, high blood pressure, hypertension, a host of other things, that works in concert with the coronavirus to put a person in a very severe situation, and for which even an extended period of time on a respirator doesn't save them. And we saw a lot of that death happen very early on in this cycle. Now, we've talked about the demographic factors of people that we have lost to coronavirus, that it is more proportionate amongst African Americans and Latino Americans than it is in the white population or the Asian population. And so the percentage, if you have 14% African American in Westchester County, a higher percentage of people who died from COVID were African American. However, the single biggest demographic has been age. 60 and older, and I'm in that cohort, 60 and older represents 85% of the deaths in New York State to coronavirus. So pretty clearly, it is not that it doesn't infect younger people, but their general health is able to fight it off better. We've lost people of all ages, but we have lost very few of them under the age of 60 as a percentage of the total. Above the age of 60, it has been much more pronounced. And if you want to cut that cohort a little bit tighter, 70 years of age and older represents 65% of all the fatalities. So it's 85% 60 and older. It's 65% from 70 and older, which is a statement to all of us, and I say us because I'm in that senior citizen cohort myself, that we have to be more concerned about our health. And the people around us who are not senior citizens have to be concerned about their proximity to those of us who are senior citizens, because that is where the infection can do its worst. If you see young kids in a school setting, and they pick up the virus and they come home, they may give it not to mom or dad who's in their 40s or 50s and can work through it as well as they can, but to grandma and grandpa or an aunt or an uncle who is of advanced age and may have some other issues as well. So that is the concern that we have when we look to see what the spread is and how it works demographically, and then also, through the ages in homes, where you have three generations of people in a home, and the oldest of the three generations are the ones most vulnerable to this. So we look at the fatality figures, and we try to make some judgments on that to see whether the percentage is rising. If we have an increase in active cases, and we have a big increase in hospitalizations, but we don't have a comparable increase in fatalities, that's obviously good news. It means that people may be getting sick, but the care they're getting in the hospital helps them fight off the disease. And again, since it's not a vaccine, or by the time you get to the hospital, it's not a vaccine. You get to the hospital and you're sick, you need an antiviral treatment, and we don't have that either. But you get to the hospital, so what's the general strategy? Make the body as strong as you can to develop antibodies to fight off the virus. And if that happens in an effective fashion, then the person, sick though they may be, survives. Now, many of those folks, when they go home, they don't become a statistic of fatality, and they have gotten the virus out of their system, but they could be weakened in certain ways. I've talked to some individuals who have successfully fought the disease off, but they have some residual lung capacity issues or some other issues that go on in terms of their body. So this is not, you're not home free. Even if you manage to get out of the hospital, you're released and you go back home. All of that is a factor. What else do we look for? Every weekday, we put out a geographical map of Westchester County. It shows the 45 municipalities of Westchester County. We release it to the press, and you'll see some of the publications will print the map where it's appropriate. Some of them will have it in their online publications, and it will show community by community how many cases they have that are active, meaning in the last 2 weeks, and then how many they've had year to date. Generally, it tracks couple of factors. The first factor it tracks is the size of the community. Yonkers has roughly 200,000 people. Buchanan, the village of Buchanan, has roughly 2,000 people. So pretty clearly the absolute numbers are going to be much, much larger in Yonkers than they are in Buchanan. So that is a factor. But the second factor that we look for when we're trying to make some judgment is the geographic dispersal of this, because in the more urbanized centers, you have a higher concentration of people. So a smaller community that has a concentrated, dense population may not have as many people as a Yonkers, but may have infection that spreads. When you deal with Ossining Village or Portchester Village, you're dealing with communities that in population are comparable to larger towns, Yorktown, Somers, that are spread out over miles between one end of Yorktown to the other, one end of Somers to the other. So it's not pure population, it's density of population. And in that regard, communities like Portchester and the city of Mount Vernon are more densely populated than Yonkers is. So they may have less people, may have less cases, but it may be a higher percentage of cases based on that geography. And the magic thing in all of this is to determine, do we have geographic dispersion of these cases? The nightmare scenario is that we have more cases and it's equally spread in every corner of the county. That means the virus is coming back across the board. We can't track it to an incident. I mentioned today the situation in Tuckahoe. We're monitoring that. You may remember a little over 2 months ago, there was an incident regarding a group of high school students in Chappaqua. That ultimately generated 27 positive cases. We tracked that. We tracked it to see, does it spread outside of Chappaqua? And it didn't, other than a community here or there, 1 or 2 cases. Right now, there's a process going on in Pleasantville because of the infection of 2 priests and a worker at the local Roman Catholic parish in Pleasantville. And the testing is going on. Right now, the numbers are coming back very good. There isn't a spike in the number of positive cases, and we're grateful for that. But we're looking to see, whenever there's an increase in numbers, if somebody says, well, you've had 100 new cases, are they spread out all over the county? Or are they concentrated? And if they're concentrated, where are they concentrated? If they're concentrated in a community that doesn't have dense population, then we worry. There's something else happening out there in the spread of the virus. And we have to look for an incident. Was there some party or some event in which people came together? Did the people come from all over the county? Or do they come just from that municipality? And that is where the role of contact tracing comes in. The contact tracers are, in essence, detectives. And they look to find out what interactions you, the individual, had who's tested positive. Who did you come in contact with? If it were me, it's the people I work with, unfortunately, here on the executive floor of our county office building. It would be the place I stopped this morning to have a cup of coffee in Rye, and the people that I interacted with there. It's when I went to the gas station and I wanted to pay in person, and I had some relatively close contact with the person who was there. Now, that doesn't mean they're automatically infected, but the contact tracer then goes through the process of talking to every one of those single people to determine whether or not they have had symptoms, high fever, runny nose, cold-like, flu-like symptoms, and a host of things that might indicate that you have COVID. And then out of that, who do they come in contact with? It's a somewhat intrusive situation. Certainly, many of us don't really remember everybody we've had contact with over the last 2 weeks. In the kind of job I have, you could just imagine what I'd have to go through to track the number of people that I've seen. But you do that in order for us to isolate, as I said earlier, isolate and quarantine people so they don't spread it any further. And that's how you control the spread. And you control the spread ultimately by shutting things down so people don't have common interactions. And we don't want to do that. We want to try to have as much of this society function, even in a reduced fashion, in the same way that we normally do. We want the normalcy in our life. We want the economic realities of our life. We want people to do the things that they want to do. And if they want to go to a restaurant, if they want to go to a store and buy goods and services, those things are important for the general economic circumstances. You saw examples in parts of the country, generally in the South, where they opened prematurely. And they went out and they interacted. And they had bars and, they made a big thing out of, hoisting, beers and so forth. And they're living life. They're not afraid of COVID until COVID spreads. And then when it spreads and you start seeing people that you know die, then it changes the complexion of it completely. We're not kidding around here. It's not something that it may have started in one place or another, but it's here now. And it's here in less densely populated areas as it is in the urban population. It's not somebody else's concern. It's our concern. We know that everything we've done in county government and everything you've done in living your lives has been changed by this. There are things that we had planned to do that we can't do right now. There are things that I put great emphasis on that I wanted to see happen in the time that I have to serve in this position. And I don't have the luxury in some of these things of doing it. Some of these things we're able to work through. Some of our environmental initiatives continue apace. Some of our initiatives on affordable housing continue apace. But, plans that I had to improve Playland had to stop. There was no way we could open Playland. There was no way we could manage it properly. We would be spreading the disease if we opened it. And as much as I want to see Playland open, that's what we do. So what it comes down to is a very calm, normal way of dealing with your life, the same thing that you do every day in your life. We don't operate our lives every day ideologically. We operate our lives every day practically. We put gasoline in our car in order for us to drive to where we have to go to do the things we have to do. And here in this job, we try to do the things practically. The numbers that I have to read to you, I'm not pulling punches. I'm going to tell you the numbers as they are. I've just said the numbers have been moving up a little bit. We're concerned about it, but I gave you a parameter of what we're looking at. We have not seen wide geographic spread. We've not seen the infection percentage get significantly above 1%. We haven't seen a rise in fatalities, and we haven't seen a significant enough rise in hospitalizations, 10, 20, 30% to make us worry, even though the active cases are up. That's leveling with you. That's treating you as the intelligent people that you are and letting you know the facts as they are, not sugarcoating it, not hiding it from you as if you're a kid. I can't tell you the truth, because if you knew the truth, you'd run around the streets and go wild. I trust that the people of Westchester County, when given the factual information and the parameters with which to interpret that information, will make intelligent decisions. And what are intelligent decisions? I've mentioned some, what we open, what we close. What's the intelligent decision for you as an individual? That's the choice you make. Do you take this action? Do you put yourself, by doing this thing, in a position of greater or lesser harm? And then you make those decisions, because at the end of the day, we're free Americans. We do not send people to your door to knock on your door to ask you questions for no reason at all. You live your life, but you live it intelligently, and you live it prudently, because the most important thing is you want to live. You want the people you love to live and survive. We've created down at Lenoir Preserve a Remembrance Garden, Ribbons of Remembrance. And really a brilliant idea, and I compliment those in my administration and our communications department, recreation department that came up with the idea. I take general credit for the things that happen in the government, but I don't take personal credit for it. It was not my personal idea. When I heard it, I said, brilliant idea, let's do it. It's a place you can go where you can access, looks like a birdhouse type setting, where you can access a ribbon and a black magic marker, and you can put on it whatever you want to say in remembrance of a loved one that you lost to COVID. And you can take that ribbon, you can tie it around. There's a little wooden device there, and there's also some trees with low-hanging branches you can tie it around. And then you can sit in this beautiful park preserve, Westchester County owned and operated, look out over the Hudson River and the banks in Yonkers that lead down to the river. And you can think. You can think about the person you love, who you've lost, and you can remember them. And you have a place to go. It's not a permanent place to recognize them. When the winter comes, we're going to have to, restructure it in some fashion. However we do it, we don't know. But we recognize that all of this is about trying to protect against the loss of lives. We have in this nation 190,000 people that have lost their life. We're approaching 200,000 people. That's not a joke. 200,000 people is roughly everybody who lives in Yonkers. It is inconceivable for you to imagine that everybody in the city of Yonkers could lose their life at the same time. That you would drive on Yonkers Avenue, come down Warburton out of Hastings, or get off on Tuckahoe Road, off of the Thruway. And everybody everywhere, from Ridge Hill to McLean Avenue to the West Side, Riverdale, all the way up to Armour Villa and Longvale, that everybody would be dead in Yonkers. That's what 200,000 people is. That's what 200,000 people is. 1,453 of them are Westchester people. I wish I could bring every one of them back. We can't do that. I hope we don't lose one other person. I'm encouraged that we went 2 weeks without losing a person. I'm discouraged that we lost somebody last night. But we are going to try our best, using the tools that are available to us, to save as many of those lives as we can. That's our job in government. If we do that well, then we're doing our job. Forget about the politics. The politics will take care of itself. I have been in public office a while. I have run for office. I know what campaigns are like. I know what a campaign will be like. Folks who've run once before or twice, they have a different vision of things. And at different levels of government, it's a different practice. But if you do the right thing, the politics will take care of themselves. Right now, we want to use our ability, the talent of the people around us as intelligently as we can to reduce the spread of this disease so less people get it. Those that get it less severely. And those that have it severely have a better chance of staying alive. And then ultimately, as we did on Friday at 9/11, when we lose them, that we never forget them. And that we show them the respect that they deserve because they were our neighbors. They once lived. They're gone, but they're not forgotten. I don't know if we have any press questions. Remotely, Catherine Chaffee, please, we'll try to answer them before we close out our briefing.
So the first one comes from David Proper. He asks, any indication where these positive tests are coming from? Are they coming from out-of-state travel?
David, we don't have enough information to identify the additional positives that we have and isolate them into specific reasons that we know of. What we're seeing is that the positive tests are not spiking in a particular area, and as a percentage of the total, they, as I just said a second ago, they are not reaching percentages that give us great concern. If we're under or around 1%, we're well below the trigger, which I believe the state has established at 5%, that if we have 5 times as many cases, if we had 250 cases, then we would be seeing something profound. We don't think that they're coming from one particular or 2 particular regions or sources. We watched for that after the 4th of July weekend where there was travel. All summer long, people were traveling and going out of town and going to different locations. And, we don't know how many of them that needed to quarantine actually did quarantine. But we don't believe at this stage of the game that we have identified a source that needs to be addressed on this. When we have a source, as we do potentially in the Pleasantville outbreak, as we did previously, then we address that source. And that's why the Tuckahoe story that I mentioned today is important. We may have tomorrow another story in another school district. We have a couple, and that's where we're going to have to watch very closely right now, the opening of our schools. We're also going to watch the opening of gyms and health clubs. They've opened in the last couple of weeks. We're going to look for that because that's a concern. There's a protocol involved for gyms and health clubs to operate. We think that they're going to operate safely, but we're going to monitor to see if we can trigger something from that. And where would you make the connection, David? We make it in contact tracing. When the contact tracers say, oh, this guy was at such and such a location, well, so was this other person, was also at that location, then the dots connect. And then we may have a source, which we wouldn't think of normally, as a centerpiece for why we have what infections we have.
Okay. Next question comes from Martin Wilbur. He asks, I was told that if a local college student is attending an out-of-state school and tests positive for COVID-19, that in some instances that case is added to the student's home county. Is that true? And under what circumstances would that happen? And how many Westchester cases might be attributed to that?
Well, it is true. The residential address of the individual is more often than not their permanent address. Now, there are some folks who'll go away to college and re-register to vote, establish their car at their residential address at college. Those individuals will be identified. We'll take the case of SUNY Oneonta, which is where they had an outbreak. They would be identified as residents of that county. But for anyone that still treats their home, their parents' home, as their residence, it would be tracked back to here. The likely diffuse nature of a state university campus will create the ability for there to be some cases here in Westchester County because some Westchester students will go to Oneonta. Would the same thing happen if an outbreak came at a private school, Duke or Carnegie Mellon or any place under the sun? Might be a little bit different because you might not get the same kind of distribution, within the geography. In terms of knowing specifically, there's a certain amount of information we can know, and then we stop, and then we reach HIPAA laws which protect knowledge of the individual. So we can find out locations, but we can't find out, more details about that person's life. So it is possible that a college student would be tracked. Their home residence is, down the street from where I live, and that is attributed as a positive case in my home community. The likelihood that an outbreak at a college campus would involve more than one or two people from a particular geography, think back where you went to college or whatever, how many people came from your hometown that were in that college? A couple. So it's less likely to affect the numbers in a dramatic fashion. Where it does affect you is where we have the college in our backyard. So SUNY Purchase, Iona College, the other colleges, those are the ones that we're watching, because if the infection were to come to one of those places, there is no infection in those colleges. Were one to occur there, then we would have to be directly involved. Even if the students lived in other parts of the country, we would have to respond as a public health department to an outbreak at a college based in our backyard. Okay, very good. Well, thank you for listening. I went on a little bit to try to explain some of the details of the stats, so you're not just looking at numbers on a page. Hopefully that gives you some context. We're certainly happy to answer any questions. Any of our friends in the press can reach out to Catherine Chaffee, our Director of Communications, subsequent to this, and we'll be happy to try to answer to the best of our ability. We're going to continue to monitor these things day to day. Our next update would be scheduled for next Monday. If we have a reason to communicate with you sooner, we will. And hopefully we'll have core information. And then wherever we do have an ancillary issue, as we did before going into 9/11 and then more recently now the village elections, we'll use this forum to give you some of that information as well. I'm George Latimer, Westchester County Executive. Thanks for watching. Have a good day and stay safe.